Here at Plantation General, we've recently started doing what's known as testing for critical congenital heart disease screening before babies go home. What happens with babies that are born with congenital heart disease, some of them, is that for the first few days of life, they're fine. And it's after a few days of life that they become acutely ill, and unfortunately some become very, very ill. In this day and age where baby stays in the hospital are not as long as they were many years ago, what happens is that some of these babies could be actually home by the time they start showing symptoms of a critical congenital heart disease. So in accordance with American Academy of Pediatric guidelines, we now screen our babies before they go home to make sure that's not going to happen to them. And this is a very simple, non-invasive test done at about 24 to 48 hours of life, where we measure pulse oximetry. That is, we measure non-invasively a baby's oxygen level on two different parts of their body, just to make sure that blood shunt going through the heart is getting oxygen as it should, that one part isn't getting oxygen while another part's not, which could be indicative of certain pathways in the heart closing, which once they ultimately closed would lead to a very sick baby in an acute emergent situation.